If you're over 60 and taking medications daily, then what I'm about to share with you may be helpful. You might be doing all the right things, like taking your vitamins, eating your greens, following doctor's advice, and trying to stay active. But there's one thing most people never think about, and it's causing serious harm to seniors every single day. It's not a bad medication. It's not a poor diet. I'm talking about supplements. Yes, those natural vitamins, minerals, and herbs we see in the shops. You've probably taken a few today. But here's the truth. When the wrong supplement mixes with the wrong medication, your body can react in dangerous ways. You may not feel it right away, but it can show up as dizziness, fatigue, confusion, a drop in blood pressure, irregular heartbeats, or even worse. That's why in today's video, we're going to walk step by step through the supplements that you should never take with certain medications. I'll explain what can go wrong, what to watch out for, and most importantly, what you can do to protect yourself. This video is all about helping you stay sharp, steady, and in control of your health. So make yourself comfortable, grab a cup of tea or coffee, and maybe even write down a few notes. Because by the end of this video, you'll feel more confident about what you're putting into your body and what to avoid. Now, let's talk quickly about why this matters so much, especially for older adults. As we age, our body changes. Our liver and kidneys slow down. Our digestion is different, and our medications often start to pile up. Many seniors take 5, 10, even more pills every day. And that's not including over-the-counter vitamins or herbal remedies. When these all mix together, it creates a chemical soup in your body. And not all of those ingredients get along. Unlike prescription medications, supplements aren't always tested for how they interact with drugs. That means something as simple as a multivitamin or herbal capsule could interfere with how your medication works, either making it too strong or not strong enough. And here's the thing. Most of these problems don't show up right away. They build slowly. Maybe you start feeling more tired, or your blood pressure fluctuates, or you have a fall that no one can explain. Sometimes it's just the result of a supplement and medication not playing nicely together. That's why it's so important we go through this list carefully. Let's start with one of the most common medication types for seniors, blood thinners. Section 1. Blood thinners. If you take medications like warfarin, which is also known by the brand name Coumadin, clopidogrel, brand name Plavix, or apixaban, brand name Eliquis, this part is especially for you. These are anticoagulant medications used to prevent blood clots, strokes, and heart attacks, especially for people with atrial fibrillation or those who have had heart surgery. Blood thinners are powerful drugs that help your blood flow more freely. But if your blood gets too thin, it can be dangerous. You could bruise easily, bleed more than normal, or even have internal bleeding. One supplement that can interfere with warfarin is vitamin K. Vitamin K plays a big role in helping your blood clot. So if you suddenly start taking high doses of vitamin K or eat large amounts of leafy greens like spinach, kale, and broccoli, you may cancel out the effects of warfarin. That puts you at risk for clots. On the other hand, supplements like fish oil, garlic, turmeric, and ginkgo biloba can thin your blood even further. For example, turmeric contains curcumin, which has natural anti-inflammatory and blood-thinning properties. When combined with a prescription blood thinner, it can increase your bleeding risk. Ginkgo biloba is an herbal remedy often used to improve memory, but it also thins the blood. Combine it with Plavix, and you may notice nosebleeds or longer than normal bleeding from small cuts. Garlic supplements are another hidden danger. While cooking with garlic is fine, concentrated garlic capsules can affect platelet function, increasing the risk of bruising or bleeding internally. Fish oil, which many seniors take for heart health, also affects how your blood clots. Taking high doses with a licorice can lead to complications, especially if you're also having surgery or dental work. Bottom line, if you're taking a blood thinner, don't start any new supplement without talking to your doctor first. Even natural ones can cause serious issues. Section 2. Blood pressure medications. Now let's move on to high blood pressure medications, another category that many seniors are familiar with. These include drugs like lisinopril, a widely used ACE inhibitor, metoprolol, a beta blocker, amlodipine, which is a calcium channel blocker, and losartan, an angiotensin receptor blocker, or ARB. These medications are designed to lower your blood pressure and reduce the workload on your heart. They're essential in preventing strokes, heart attacks, and kidney damage. But they're also very sensitive to certain supplements that can tip the scales too far or interfere with how the medication works. Let's start with potassium. Medications like lisinopril and losartan can raise potassium levels in your blood. If you take potassium supplements or use salt substitutes that contain potassium, you could end up with too much. That's called hyperkalemia, and it can cause muscle weakness, irregular heartbeat, and even sudden cardiac arrest. This is especially risky if you're not being monitored regularly. Another supplement to avoid is licorice root. This is not the candy form you might remember from childhood, but rather the concentrated herbal form found in teas or capsules. Licorice root can raise your blood pressure, directly opposing the effects of medications like amlodipine or metoprolol. It does this by reducing potassium levels and increasing water retention and blood volume. Next is coenzyme Q10, or CoQ10. While CoQ10 is often promoted for heart health and energy, it also lowers blood pressure. That might sound helpful, but when combined with a medication that's already doing that job, it can push your pressure too low. You may experience dizziness, fainting, or a dangerous drop that increases fall risk. And let's not forget St. John's wort. This herb is often used to treat mild depression, but it's notorious for interfering with medications. It speeds up how your liver processes drugs, which means medications like metoprolol or losartan may not work as well. That puts your heart and blood vessels at risk, even if you don't feel any immediate symptoms. If you're managing high blood pressure, the safest path is to avoid adding any supplement without clearing it with your doctor or pharmacist. What seems like a helpful herb could undo all the benefits of your medication or even make your condition worse. Section 3. Cholesterol medications. Cholesterol-lowering medications, also known as statins, are some of the most prescribed drugs for older adults. These include atorvastatin, brand name Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor. They are designed to reduce LDL cholesterol, sometimes called the bad cholesterol, and help prevent heart attacks and strokes. But when combined with certain supplements or even foods, these statins can cause serious side effects. One of the biggest concerns is grapefruit and grapefruit juice. Grapefruit contains compounds that block an enzyme in your liver, CYP3A4, responsible for breaking down statins. This means the medication builds up in your bloodstream to dangerously high levels. That raises the risk of muscle pain, liver damage, and in severe cases, rhabdomyolysis, which is the breakdown of muscle tissue that can lead to kidney failure. Another common supplement is niacin, also known as vitamin B3. In large doses, niacin is sometimes used to improve cholesterol levels. But when combined with statins, it greatly increases the risk of muscle weakness and liver toxicity. Red yeast rice is another problem. It's marketed as a natural cholesterol-lowering remedy, but it actually contains compounds similar to statins. If you're already taking a prescription statin, adding red yeast rice can double the effects, putting more strain on your muscles and liver. Even fiber supplements like psyllium husk can interact. While fiber is healthy, taking large doses around the same time as your statin may reduce how much of the medication your body absorbs, making it less effective. If you're on a statin, avoid grapefruit and grapefruit juice completely. Be cautious with cholesterol support supplements, and always talk with your doctor before adding anything new to your routine. So, my friend, here's the big takeaway. Supplements are not always as harmless as they seem. Even natural herbs and vitamins can have powerful effects on your body, and when mixed with prescription medications, those effects can turn dangerous. The truth is, your doctor or pharmacist should always be your first stop before starting a new supplement. A quick conversation could save you from weeks, months, or even years of health problems. Remember, your health is a delicate balance. Medications keep you steady, but supplements can tilt the scale if you're not careful. By being informed, asking the right questions, and double-checking before you add anything new, you're giving yourself the best chance to stay strong, safe, and independent. If you found this video helpful, be sure to share it with a friend or loved one who might also be mixing supplements and medications without knowing the risks. Sometimes a little information can make a huge difference in someone's life. Stay safe, stay healthy, and I'll see you in the next video.